WHO Multiple Dysplastic Syndrome Classification System disease, marrowblasts, clinical presentation and cytogenetic abnormality. Number 1, refractory anemia, marrowblasts less than 5%, clinical presentation anemia, cytogenetic abnormality 25%. Refractory anemia with ring sideroblasts, RARS, marrowblasts is less than 5%. Clinical presentation is anemia, more than 15% ring sideroblasts in erythroid precursors, cytogenetic abnormality 5 to 20%. Next is the MDS with isolated deletion SQ del 5Q or SQ syndrome, marrowblasts are less than 5%. Clinical presentation is anemia with normal platelets. Cytogenetic abnormality is 100%. Next is refractory anemia with multilineage dysplasia. Refractory cytopenia with multilineage dysplasia, RCMD, marrowblasts are less than 5%. Clinical presentation is biocytopenia or pancytopenia. Cytogenetic abnormality is 50%. Next is refractory anemia with excess blasts type 1. Marrowblasts are 5 to 9%. Clinical presentation is cytopenia plus minus peripheral blood blasts less than 5%. Cytogenetic abnormality is 30 to 50%. Next is refractory anemia with excess blasts type 2. Marrowblasts are 10 to 19%. Clinical presentation is cytopenia plus peripheral blood blasts present. Cytogenetic abnormality is 50 to 70%. And next is myeloblastic syndrome unclassified. Marrowblasts are less than 5%. Clinical presentation is neutropenia or thrombocytopenia. Cytogenetic abnormality is 50%.